Hi everyone, thank you for taking the time to watch this video about our call for the Secretary of State for Health and Social Care, Matt Hancock, to set up a cross-sector resilience task force. This is something my fellow campaign coordinator, Sir Norman Lamb, and I have been talking about for a while. Some of you may have seen a series of tweets I did on the potential aftermath of the coronavirus pandemic, which led to a healthy discussion and a lot of support. So I wanted to provide some more information about the Resilience Task Force and to say a bit about how you can get involved. First of all, we want to acknowledge the efforts of the government, key workers and every organisation and person working to help those affected by the current coronavirus pandemic, and thank you for everything that you're doing. Once this immediate crisis is in abatement, however, we believe that we'll be facing an altogether different crisis, one that is equally as damaging to our society and to our communities. We're already seeing evidence of an upsurge in domestic abuse, domestic homicide, significant increases in calls to Childline for counselling support related to the impact of the coronavirus. We're also seeing a range of data on increases in mental health concerns, alcohol use, and a worrying upsurge in online child abuse imagery. Indeed, the United Nations has recently called for urgent action to minimise and address the widespread psychological distress that we're seeing in the coronavirus affected populations globally. Research on past epidemics highlights the negative impact on people's mental health resulting from these kind of global pandemics. We're living in a time when vulnerable adults and children have been isolated within their homes and other care environments, where they've had increased contact with abusive individuals, carers and partners, and they've been cut off from safe relationships and previously relied upon sources of support. This summer will sadly be the defining episode in the life of many individuals and families who will for years to come be dealing with the emotional, social and health consequences of what they're going through now. The exposure of the population to childhood adversity and psychological trauma is clearly increasing by the day, and this coronavirus generation will potentially be in need of help for years to come. This will need to come from services and agencies that were already, before the coronavirus outbreak, unable to meet the demand they face from vulnerable help-seeking people every day. This situation will only add to this burden and the intergenerational impact, which will be predictable and costly unless we intervene early and with a cross-sector response. The Centres for Disease Control and the World Health Organization both recognise that preventing and mitigating the impact of childhood adversity is an important public health priority and represents an opportunity to improve the health and well-being for present and future generations. On the workforce front, we're seeing concerning reports and even first-hand from colleagues that staff in key roles are facing significant personal risks and facing impossible decisions every day as the NHS, social care and other key workers attempt to manage this threat to our communities. Many dedicated and caring professionals will inevitably be exposed to high levels of stress and potentially traumatising experiences and may need help to overcome the psychological effects of these events. For some key workers, the risk of burnout, compassion fatigue and traumatisation is very real, and while a good proportion will likely bounce back and recover from these distressing experiences, a significant proportion will not. Significant numbers of workers will need ongoing help and support in the workplace and outside of it if they're to live healthy lives and to continue to contribute to the NHS and other key services. Poverty and social inequality are sources of enormous stress for families, and we know that when parents are overwhelmed by stress, they can struggle to meet the basic emotional and physical needs of their children, and this can adversely affect their physical, emotional and social development. This can have lifelong implications, impacting a child's developing brain and immune system, leading to susceptibility to mental health problems and chronic diseases later in life. We know that rates of mental health problems and diseases such as high blood pressure, heart problems, inflammatory conditions and diabetes are disproportionately high, both in people who've experienced adversity in childhood and also for people living in poverty. It's essential that the social and environmental determinants of health are recognised and addressed as part of our collective response to this coronavirus pandemic. We have a rare opportunity to influence our culture and shift attitudes towards a more balanced and open perspective that understands and places equal value on physical, emotional and social well-being. Now is the time to have a national conversation about the psychosocial impacts of adversity, trauma and the wider determinants of health, and to make sure that this crisis does not leave a legacy that costs us dearly for generations to come. We've written to the Secretary of State for Health and Social Care, Matt Hancock, asking him to convene a cross-sector resilience task force. with a mandate and appropriate funding allocated to support the government's response to the inevitable and damaging, costly social and psychological consequences that will no doubt follow this painful chapter in our nation's history. There are already a number of organisations committed to working with the government and its representatives as part of this proposed task force. We want to build and execute a response plan in the short, medium and long term, using all of our collective experience, expertise, networks and resources. We are ready to act, and we firmly believe that we cannot simply go back to business as usual after this pandemic subsides. To do so, we believe, will lead to decades of unprecedented human and financial cost. We can't afford to wait and watch this unfold. We must act now. Please support our call for a resilience task force. Share your views on Twitter and LinkedIn using the hashtag resilience task force. Tweet and write to your MP. Sign up as a supporter on our website, www.resilience-taskforce.co.uk. And here you can access updates on our campaign, as well as resources and ideas on how to influence nationally and locally. Thank you so much for your support.